In the city of Tanawan, Batangas, a 53-year-old woman has reportedly died last September 21, 2019 because of a rare infection called Meningococcemia. After the said event, there are multiple cases of death that follow within the same region because of a claimed bacterial infection, including a 1-year-old girl on September 27, 46-year-old man on September 28, a 4-month-old baby from Liantown, and a 2-year-old from Nasugbu last September 29. Fever, headache, rash, and nausea. Those are the early symptoms of meningococcemia. But what is meningococcemia?
Meningococcemia is an upper respiratory tract infection caused by the bacteria Neisseria meningitis. It is the same bacteria that may cause meningitis. When the bacteria infect the membrane that covers the brain and spinal cord called the meninges, it causes meningitis. But when it remains in the bloodstream without affecting the brain or the spinal cord, it's meningococcemia. Aside from the symptoms mentioned earlier, blood clots, patches of bleeding under the skin, lethargy, and shock will also develop as the infection progresses. Simply being exposed to the bacteria isn't enough to acquire the disease. The bacteria is mainly transmitted through coughing and sneezing. It is mostly likely to be acquired by children under 4 years old, but remember that the infection are not exclusive to them. Group living situations such as dormitories help develop the risk of meningococcemia, as well as being in very close contact to someone who has acquired it. According to the latest data of DOH, a total of 130 cases of meningococcal cases are reported nationwide, 18% of which is from NCR, followed by the 16% from the Region 4A. There were a total of 68 reported deaths from the reported cases.
Going back to the bacterial diseases causing death in Batangas, among the 5 cases, only 4 deaths are confirmed by DOH as caused by meningococcemia. The case of the 46-year-old man are still on monitoring and is yet to confirm if it is the case of meningococcemia. They advise the public to be calm yet vigilant. Remember not to jump on conclusions that may cause false alarm and panicking. Despite the 4 cases, DOH Calabar Zone Director Eduardo Janero stated that those are the isolated cases and there is no outbreak, adding that this happened in 4 distant areas of the provinces. Way back in 2012, 2013, and 2014, multiple reports of meningococcemia deaths have been acquired in several areas across the Philippines, but the DOH director of each region claimed that there is still no declaration of outbreak in their own respective regions.
Legitimate outbreaks of meningococcal diseases in the Philippines has been declared in the years 1988 in Mindanao, 2002-2004 in San Lazaro Hospital, and years 1993, 1995, 1998, 2004, and 2005, all in the Cordillera Administrative Region. According to Dr. Senya Jaramillo Fabay, 2005 CAR's case has been the country's largest meningococcal outbreak, affecting 376 patients, half of which are 5 years old and under. About a third of the patients died. Vaccines such as MPSV4, MenB, and MSV4 are available as well and can be shot to any person at any age, especially younger ones, since they are the most prone. But when the disease has already been acquired, early intravenous antibiotic therapy shall be conducted. Antibiotics and cephalosporin are the initial treatment for the infection. Other medications such as vasopressors are needed to help maintain the blood pressure. Hemodialysis may also be conducted as well once a kidney failure has been discovered.
In the end, cleanliness is always the safety measures advised by the health organization to avoid gaining meningococcemia or any meningococcal diseases in general. The disease may be rare, but it always exists in some part of our country. It was never terminated, but it can be prevented.